So you've tried everything they've told you to try. You've cut caffeine back after lunch. You stopped drinking water after supper. You put your smartphone away early in the evening. You've tried melatonin, magnesium, chamomile tea, maybe even sleeping medications. And you're still there lying in bed at night, eyes wide open, counting the hours until you have to get up in the morning. Here's the problem most people miss. You don't just have one sleep problem. Your aching joints, your hot flashes, getting up to pee, the racing mind. On the surface, they may seem like separate issues, but there's one thing that can connect all of them together, and that's inflammation. Low-grade chronic inflammation, sort of running beneath the surface that you don't even know is there. And once the poor sleep starts, the inflammation actually makes it worse. Inflammation can make gut problems worse. It can make aches and pains worse. It can make hot flashes worse. It can make your racing mind worse. So the inflammation starts feeding the poor sleep loop. That's why all those interventions that you tried had limited or almost no improvements for you. They may have been addressing one part of a multifactorial problem. In this video, we're going to talk about these self-feeding loops that lead down the path to poor and disrupted sleep. And we'll talk about how these loops can actually feed each other and make each other worse. And all through this video, we're going to talk about one place where you can jump into all of those loops and hopefully begin to see improvements. One of the most practical and effective things you might be able to try for your sleep could be sitting on your plate. So let's talk about sleep issues and inflammation. So you don't have one sleep problem, you probably have several. A few things on this list: racing minds that won't switch off, aches and pains, stomach problems, hot flashes, night sweats, getting up to pee, anxiety issues, depression issues, too much caffeine, too much water after supper. When you look at this list, it's a little bit easier to see why those one single interventions that you were trying may have had limited effectiveness. So let's talk about that one common thread that can weave through them. Let's talk about some of the conditions first, though. Pain, joint pain, that's an obvious one. If you can't get comfortable in bed, you're going to have trouble sleeping. Anxiety and stress, this is the most common one that people typically lean on. Those racing thoughts in your head at night, we typically attribute them to things going on in our lives. We don't normally attribute them to physiological and hormonal neurotransmitter changes that may be affecting the brain. Bladder frequency, getting up to pee. That can be a normal function, but most people can get up to pee and go back to bed. We're talking about people who get up to pee multiple times a night and never get back into a fully rested sleep. Digestive issues, abdominal discomfort, gas and bloating, and GI issues. They can keep us up at night. Histamine issues, we're going to talk a lot about that shortly in terms of how that can impact all of these situations. Hormone imbalances, this is another common one that typically gets leaned on in 40 to 50-year-old women. High and low thyroid function can impact sleep as well. Now, that one common thread that we talked about, the inflammation, it can impact directly all of these things. And we have several other videos on this channel talking about these specifically. We have an IBS video on how inflammation affects and causes a lot of our gut issues. There's some obvious versions there as well with inflammatory bowel diseases and things like IBS and things like that. Gastritis, which is an inflammation of the stomach lining. Inflammation can affect the bladder, cause autoimmune issues like interstitial cystitis, but it can also cause simple things such as urinary frequency, especially at night. There's a direct correlation between anxiety and stress and inflammation. We have a separate video on that, on chronic fatigue. Joint pain. What do people typically take for joint pains? Quite often they're going to take an anti-inflammatory. That one's self-explanatory. Histamine issues. Histamine is an inflammatory chemical. That's self-explanatory. Thyroid gland, for example. Autoimmune thyroid issues like Hashimoto's can lead to high thyroid and low thyroid function. Those are known to impact sleep patterns. So when we look at all these issues that could be impacting your sleep, rather than trying to address each one of them individually, it's far more effective to see if there's one pattern or one common thread that goes through all of them, because if we address that, we're going to get the biggest bang for our buck in terms of impact for that treatment. So we're not going to get too much into categories of sleep and sleep definitions and diagnostic criteria. We're going to broaden it here for you. What type of sleeper are you? Are you the person that wakes up in the middle of the night, usually the same time of night, night after night? We can roll over and we don't even have to look at the clock. We know it's 3 o'clock or 3:30 in the morning. The wired but tired sleeper. We'll go to bed, we're exhausted, but we sit there and we can't get to sleep. The hot flash sleeper. This isn't just for perimenopausal and postmenopausal women. I've treated hot flashes in 14-year-old little boys before. The need to pee 3 times a night sleeper. This is for both men and women, increased urinary frequency. The desire to pee wakes us up, and then once we're up, we have trouble getting back to sleep. Or are you the type that has slept 8 to 10 hours and you wake up feeling like you haven't slept at all? Most of us who have sleep issues have some combination of these factors, and sometimes there's factors that aren't even on this list. One key point to keep in mind, though, is that inflammation can be associated with all of these things, and that's what we're going to talk about next. An important disclaimer here, though, this video isn't for issues that don't have to do with inflammation, more serious issues like apnea, loud snoring, gasping. If you're a very loud snorer, if you wake up in the middle of the night gasping for air, if you've been told you have apnea, if you're falling asleep uncontrollably through the day, or if any unusual sleep or any unusual symptoms at all come on very quickly and rapidly, you need to seek medical attention for that. There are lots of causes for sleep issues that may have nothing to do with diet and inflammation. Have those investigated by your health practitioner. So pain can be a double whammy on the sleep. It can actually be a triple whammy in some cases as well. The obvious mechanism for pain is you can't get comfortable in bed. Your hips are sore, your knees are sore, your back or your neck is sore. That pain can wake you up directly. That's an obvious mechanism that doesn't need much explaining. But let's think about that pain for a minute. Quite often, what do we take for the pain? We can take anti-inflammatories for back pain, hip pain, joint pains. An anti-inflammatory, like an NSAID drug, non-steroidal anti-inflammatory drug, it will only help with the symptom if it's caused by inflammation. So that's a simple little test you can do. Have you ever taken an anti-inflammatory medication and has it benefited your sleep? If it has, that's a direct correlation between the inflammation problem and your sleep problem. So the other key factor that inflammation and how it can impact your sleep is based off these cytokines right here. You're going to see this mentioned over and over and over again. These inflammatory signals, these cytokines, they can actually cross the blood-brain barrier, get up into the brain, and they have direct impacts on a lot of the neurochemistry there, which is associated with good quality sleep. So in simple form, inflammation can cause pain that will make you not sleep. The biochemistry associated with inflammation can actually directly impact your sleep. We have a separate video on inflammation and arthritis pain and muscle and joint pain, arthritis and diet, hidden inflammation. There'll be a link in the video description below. Now, pun intended, the next topic is a hot topic one, hot flashes. They're not only about estrogen. Hormone decline, estrogen, progesterone, testosterone at perimenopause and menopause, but also testosterone decline with men at andropause. There are mechanisms for how those hormones can actually lead to hot flashes, imbalances, and decline in the hormone. But the mechanism can be quite different from what you're thinking. Estrogen, progesterone, testosterone, they're also significant anti-inflammatory hormones. They fight inflammation. We don't think of them that way. We think of them as sex hormones. So as we get older, as our hormones start to fall, the inflammation that they were suppressing starts to erupt and come to the surface. A lot of those symptoms are actually inflammatory symptoms. If you think of a postmenopausal woman who gets muscle pain or joint pains or gets headaches, it would typically get blamed on menopause. Well, what's the medication that quite often they go to for those symptoms? They go to Advil, ibuprofen, forms of anti-inflammatory medications. Those medications have no hormone component to them. So if that person gets relief from those symptoms with those medications, the symptoms are actually inflammatory symptoms. The hormone decline revealed the symptoms. It actually didn't cause the symptoms. So as we've said, the decreased anti-inflammatory effects can increase the inflammatory response in the cytokines that we've talked about before. Those can directly impact sleep. So the take-home point here is hormones at menopause and sleep issues, it's not just the hot flash mechanism. There's actually a significant inflammatory component to that. We have a separate video, the link will be in the description, just on menopause and andropause and inflammation and how these hormones are impacting that. So with the bladder, sometimes it wakes us up. We get the desire to void our bladder, so we get up and we go void our bladder. But sometimes we just end up blaming the bladder when the bladder is not the primary problem. Histamine issues, which is one of these inflammatory compounds we're going to talk about shortly, can have direct impact on smooth muscle, both in the bowel and in the bladder, which can stimulate and increase bladder activity, the desire to void. So histamine can impact sleep directly. But there are other inflammatory cytokines, the interleukins, interferons, that can also have the same impact on the bladder. The cytokines can impact the bladder and the need to void our bladder, which can wake us up, but the cytokines, again, directly can affect our sleep. Wired and tired. This is another thing we hear from patients all the time. I go to bed, I'm exhausted, but my mind just won't turn off. They describe it as being wired but tired. Well, histamine is an excitatory neurotransmitter in the brain. It's an alert hormone. If something startles us, if something happens that we have to address acutely or very quickly, histamine is one of the compounds that can actually help us do that. So it would stand to reason that if we have a histamine issue or a histamine response, either lying in bed at night or before we go to bed at night, it's going to put us into an alertful state. So it's kind of like we're in crisis management mode, although we're exhausted, wired and tired. Histamine also can directly cause some of these other conditions that can also directly impact sleep. Histamine can cause hot flashes. It can cause digestive issues, reflux in the stomach, lower bowel issues, constipation issues. Histamine can be associated with apnea issues, which is a disrupted breathing pattern in bed at night, which can affect our sleep directly. Histamine, most people recognize it as the allergy chemical. We don't sleep as well when we're suffering with allergies. There's many other mechanisms as well, but again, histamine can be a direct impactor on sleep, but it can also impact these other conditions that can affect our sleep. Now, sleep apnea is a very serious condition, and it has to be addressed medically, either through CPAP or other means that would be available to the patient. But apnea isn't unaffected by inflammatory issues as well. Apnea is when the soft tissues in the back of the throat and the epiglottis, as we go to bed at night, these soft tissues sort of collapse on the back of the airway. It obstructs the airway, obstructive sleep apnea. Well, that obstructive airway causes a gasp for air. We're not getting enough oxygen. So that puts our body into alert mode, crisis mode, so we wake up. Eventually, we may fall back asleep again, but again, that airway collapses. Well, that soft tissue that's collapsing in the back of the throat, that can get inflamed, and quite often does. If you inflame a tissue, the tissue gets red and it swells up a little bit. Well, that soft tissue, if it gets swollen, it's going to obstruct that airway even further. The plug in the airway swells up and it becomes bigger. So addressing food and inflammation isn't a cure for apnea, but it can certainly help impact other treatments for apnea. The low oxygen saturation levels in the blood, which are common with people suffering with apnea, can also directly impact sleep. Another important loop we're going to see here is that poor sleep can actually promote the inflammatory pathways. So we get into this feedback loop right here. So once again, apnea is a very serious issue. It's very hard on your heart. It's very hard on many parts of the body. It has to be addressed. I'm not suggesting that food and inflammatory food work can fix it, but it can certainly help with it. So if you suspect you may have apnea issues, you need to speak with your doctor about that. So now we'll talk about the brain chemistry that most people are aware of, and this would be things like serotonin, epinephrine, norepinephrine, and these types of compounds. Serotonin is a precursor molecule to melatonin. Tryptophan, an amino acid, gets turned into something called 5-hydroxytryptophan, or 5-HTP, which then gets turned into serotonin. Serotonin then in turn goes down a pathway to melatonin. So serotonin issues, deficient serotonin levels, can actually lead to deficient melatonin levels, which can impact sleep. Norepinephrine and dopamine, the catecholamines, when those are elevated, those are sort of your wakefulness and alert and get up and go hormones or neurotransmitters. If you're in get up and go mode when you're in the middle of the night, that's not going to lead to a good night's sleep. So these are the pathways that most people are sort of aware of. Many people will say, yes, there's probably a serotonin issue there or a neurotransmitter issue there. But very few people ask what could have led to that serotonin deficiency in the first place. That's where inflammation comes in. These inflammatory cytokines don't actually break serotonin down, but they lead to a decreased production of it. They divert tryptophan away from the serotonin melatonin pathway down another pathway. We won't get into that in this video. So when we think of having low serotonin and need to support my serotonin, that's where medications and things are typically targeting. We should also be asking, why am I deficient in serotonin? Inflammation can be one of those key factors. So those cytokines can impact neurotransmitter levels over here, but again, they can also affect sleep directly right here. The poor sleep can come back and make the inflammation worse. So there's a couple feedback loops there. Stress would be the other obvious and more common culprit when people think of what's causing their stress issues. But there's a neurochemistry and a biochemistry aspect to stress and how it impacts sleep as well. The stress can raise dopamine and norepinephrine levels, those alert hormones that we talked about. Well, those can lead directly to an inflammation, but those can also directly impact sleep down here. Psychological stress, well, cortisol is one of your stress hormones. So if you're in high stress mode, cortisol can be elevated to help fight that stress. Well, cortisol is a form of adrenaline. So if you're in high adrenaline mode in the middle of the night, that's not going to lead to a very restful sleep. Cortisol is also one of your major anti-inflammatory hormones in the body. So if your cortisol is being shunted over to deal with psychological stress, there's going to be less to deal with inflammation. So the inflammation can actually come back and impact sleep through all these mechanisms that we're talking about. You're going to find with all these loops that it can get a little bit interwoven, interconnected, and a little bit hard to follow. You don't have to follow it. All you really have to do is recognize this one component that is a part of all of these loops. And again, that's the inflammation. Thyroid dysfunction is a known impactor for sleep issues. Either hypothyroid, low functioning thyroid, or hyperthyroid. Both can disrupt normal, healthy sleep patterns. Well, there's an obvious inflammatory component here as well. A condition called Hashimoto's disease is an extremely common autoimmune condition found in people. It's the immune system attacking the thyroid gland. That can lead to either high or low thyroid function, which can then impact sleep. That's an inflammatory condition by definition. Inflammation can also impair the conversion of what's called T4 to active T3 or active thyroid hormone. So this is where people can have normal blood tests and lab tests, but still be hypofunctioning from a thyroid point of view. The inflammation cytokines can also, again, directly impact the sleep. Next slide. No, lie down. So feeling tired and sleeping well don't always go hand in hand. A good way to describe this would be sickness behavior. This is when you're sick, when you get a virus. Your immune system produces inflammation, cytokines, and antibodies to target the virus and to kill the virus. One of the other roles for those cytokines is actually to go to the brain. They get up into the brain, and they tell the brain and the body to slow down so you can rest and recover. That slow down feeling is going to be perceived as fatigue and exhaustion and you're tired and a signal that you need to rest. The paradox here is those same inflammatory compounds that are telling your body to slow down and rest are also disrupting your sleep. So this can mean you can be sleepy and exhausted and tired and get a very unrestful, very unproductive sleep. So why am I talking about viruses and sickness behavior and a video on food and inflammation? Well, we can produce the same inflammatory cytokines and antibodies to a food. The difference there is we eat the food every day. A virus we might get once or twice a year, and then it goes away. Well, if we have the same inflammatory trigger response going on every time we eat a food, you can see how that fatigue state and that inflammatory state just never has a chance to settle down. This is where a lot of the chronic issues happen with inflammation. So with all of these hormonal and biochemical imbalances and strains that we just talked about, those can directly impact sleep and fatigue levels through the day. But we have to be awake through the day. We have to look after kids. We have to go to work. We have things we have to do. So we suffer through that day. We're exhausted. But the same inflammatory cytokines that can lead to those hormonal and biochemical changes can also directly come back and impact sleep and fatigue issues. The poor sleep can lead to more fatigue. More fatigue, a less restful sleep can actually perpetuate poor sleep. So again, more of these loops that we're talking about. All these contributors that we talked about as well, they don't stay in their own lane. They aren't separate and unique from each other. They all directly impact each other. Chronic pain, we need hormones to deal with the pain. The pain can happen in the bladder so it can get us up at night. Chronic pain is a physiological stress in our body, and that stress can keep us up at night. Our hormones can affect pain levels. Our hormones can affect bladder function, and our hormones affect brain chemistry. Our hormones can affect stress levels. Most of these factors can all impact each other. But if we look at the overall picture, look up here and look where they all end up. So rather than targeting each of these individually, if you target one and treat one and you get partial response, you can now see why it's only partial. That is just one issue in a bigger complex of other issues. So the best way to address that is to look up here. What factor could be impacting most of those? And commonly there's an inflammation issue here. Now we're going to talk more about these loops that I referenced earlier, these inflammatory loops. We go to bed, we have an inflammatory issue. The inflammation can impact sleep, like we talked about. We have less restorative sleep. Less restorative sleep leads to more inflammation, and the loop goes around. The same problem with hormones. We have hormonal shifts that can happen with aging, perimenopause, andropause, menopause, things like that. Well, one example, there's many different hormone shifts that can happen, but one would be elevated histamine activity right here. Histamine promotes wakefulness. Wakefulness will lead to a fragmented sleep. This leads to increased inflammatory issues. So again, another loop right here. Another loop with an obvious way that you can impact it. Digestive issues, gut inflammation right here. This can lead to disturbed sleep. The hormonal changes associated with that and the inflammation can weaken the barrier on the digestive tract. We talk about that in our leaky gut video. This can lead to increased immune activation, increased exposure to these antigens and allergens in our diet and in our environment. This increased immune activation is going to increase inflammation in the gut, and it loops back down around. Another significant loop where inflammation can be a major contributing factor to its perpetuation. We often see sleep issues with mood and anxiety and depression disorders, and the reason isn't as obvious as you might think. It's easy to think I'm depressed because I don't sleep. Well, maybe you're not sleeping for the same reason as you're depressed or anxious. Increased inflammation can reduce serotonin. The next video in our series is going to be anxiety, depression, and inflammation, so I'd encourage you to subscribe if you want to see that video. The reduced serotonin leads to reduced melatonin. Reduced melatonin can lead to sleep issues. That's why people who take melatonin, if they're deficient in it, they see a benefit from it. Well, the poor sleep can lead to a worsening mood, as well as the reduced serotonin can lead to a reduced mood. Both of these factors can come back up and make the inflammation worse. Again, another major loop. There's many other loops that we won't have a chance to talk about here. Just a couple of them. The pain loop. We have a pain problem. It leads to sleep disruption. This leads to increased inflammation. The pain worsens, so the cycle repeats. The stress loop. Psychological stress, the initial problem, leads to a sleep disruption. This can lead to increased inflammation. The stress worsens. Inflammation is a stress, just like psychological stress is. And both of those factors can come back up and make the initial stress worse. The apnea loop, we talked about that one a little bit. Obstructive sleep issues lead to sleep disruption. This leads to more inflammation. This leads to more inflammation. That can actually worsen the apnea, and the loop continues. So with all of these complex interconnected loops that we've just talked about, they all have a similar self-feeding pattern. The major disruptor can lead to a whole bunch of changes that can actually make the initial disruptor worse. And in all of those loops, the one factor that we kept seeing over and over again was chronic inflammation. This can be something that can disrupt the sleep directly. It can lead to worsening inflammation. Inflammation can come back and make the disruptor or the inflammation worse. The takeaway point here is inflammation is a place where you can jump into, or a node that can jump into all of these loops and potentially stop the cycles. If you have magnesium deficiency and you take magnesium, that will impact that one item. If you're melatonin deficient and you take melatonin, you might get a sleep benefit from that. But what if inflammation is what led to the melatonin deficiency and what led to the digestive issue that led to the magnesium deficiency? So I'm not suggesting those other tools aren't helpful and they can't be used. But if you need multiple of them, and if they only work as long as you take them, you're missing something. And that inflammation component might be that missing piece of the puzzle. So when you tried those things we talked about before, melatonin, magnesium, chamomile tea, sometimes even the sleeping medications, they were only addressing one or two or three of those nodes that we talked about. And with all of those loops, there's far more nodes that need to be addressed. So when you took those things, you got a partial response. It was because you're only addressing part of the overall problem. Now, quite often people will say, well, inflammation's really bad. I need to treat the inflammation. You can take something to fight inflammation. In fact, if you're suffering with these types of issues, there's a good chance maybe you are taking some anti-inflammatory medications or supplements, but you're still having sleep issues. The anti-inflammatory treatments will try and suppress the inflammation. They don't get rid of what caused the inflammation in the first place. They address the symptom of the problem, not the trigger for the problem. An anti-inflammatory may help with inflammatory muscle and joint pain and may help you sleep, but it won't address what triggered the inflammation that may have been causing the joint problem in the first place. We have to see if we can get further upstream into that root cause. Now, people will say to me, well, I had testing done that the inflammatory markers didn't come back abnormal and my thyroid was normal, everything was normal. Well, normal lab tests don't always mean everything is normal. Many of those loops and the chemicals and compounds that we talked about, there aren't standard testing options for those in the typical medical doctor's office. Those tests are designed to find overt pathology and disease. Quite often, they're not designed to find these types of borderline subclinical type of issues. So there's no standard test for cytokines and dopamine and norepinephrine and serotonin and things like that. Now, from an inflammation point of view, there's some really good examples that make this point clearly. People with asthma, which is an inflammatory respiratory condition, quite often they'll have negative inflammatory markers. I have psoriasis triggered by a food. I've had my inflammatory markers tested many times before and they come back negative. People get tested for rheumatoid or inflammatory arthritis and it comes back negative, but they will use anti-inflammatory medications to treat that. So just because we had a couple negative inflammatory markers doesn't mean there's no inflammation there. So normal tests don't always mean nothing is wrong. So if inflammation is part of this picture, where is it coming from? For most people, the biggest single contributor for it is food. It's in our diets. That's what we're going to focus on for the rest of the video. So from a food reaction point of view, there are three major types that people can have. People tend to use these terms that we're going to talk about synonymously. We're going to talk about food intolerance, food allergy, and food sensitivity. People think of them as just food reactions, but technically they're extremely different. And it's these differences which make or break whether people get these things figured out. So food intolerances are what we call non-inflammatory food reactions. They don't involve a direct immune response. Think of lactose intolerance. Someone drinks lactose or milk sugar. It should normally be absorbed in the small intestine. Well, people who are lactose intolerant are deficient in an enzyme called lactase. Lactase chops up the lactose so you can absorb it. If you don't have enough of that enzyme, that lactose, when you eat or drink it, will go to the colon undigested. The colon is a trash compactor filled with yeast and bacteria. It ferments that lactose. The bowel fills up with fermentation byproduct, fluid and gas, and the bowel will cramp and spasm so you can eliminate it. When we described that whole process, we never said the word immune system or inflammation once. Food intolerances are non-inflammatory food reactions. They don't involve direct immune responses. Food allergies are what people typically hear of. This is what would be tested for in an immunologist office or an allergist office. So it's the scratch testing or skin testing. These are called immediate hypersensitivity reactions. The inflammation associated with these reactions are tied to antibodies called IgE antibodies. They're tied to mast cells, and these mast cells are filled with histamine. Histamine causes redness, swelling, itching, hives. That's why people take antihistamines for seasonal allergy issues. The other type of food reaction, these are called food sensitivities. They are immune reactions to foods. They are a type of allergy. It's just a different type of allergy. The delayed is the critical part here. We're going to talk more about those shortly. The inflammatory compounds here are the antibodies and cytokines. And in all those previous slides, you heard me talk about cytokines. It's this type of immune response that can produce a lot of these compounds that can actually impact sleep. So this delayed hypersensitivity reaction plays a key role in sleep issues and also all kinds of other health issues as well. Now, the technical differences between these food reactions is critical. If you don't have a good understanding of the differences and the symptoms associated with it, the timing and things like that, you are going to struggle trying to figure out your food issues. So we could spend a whole video or two videos just talking about these. We're not going to do that here. In the description below, you're going to find a link to a free guide called Food Intolerance, Allergy, or Sensitivity. The differences are critical. This is the work that I do with every patient in office. This is the first work I do with them. We have to educate people on the differences here, so when they go to implement diet protocols and treatment protocols, they will look for the right things, they will do it the right way, and do it for long enough, and all these little technical differences. So to learn more about the specifics of this, please download that free guide. We're going to talk about them briefly right here. So how does food become inflammation? It involves an immune reaction in your bloodstream or in the mucous membranes. Immune cells, white blood cells, there's many different types. There's dendritic cells, there's antigen-presenting cells. These cells are the generals of your immune system. They go through your body to look for foreign invaders or attacking body. When they see an invader, they need to be able to grab it and elicit an immune response against it. So imagine this is a white blood cell. You see these little receptors here. They're like little arms with feelers on the end. And those feelers are like a lock. Each lock is designed to bind to a certain key. You can see that here. We have a round lock here. It'll bind to a round antigen or allergen. A square one here will bind to a square allergen. A triangular one here, a triangular allergen. So what we're reacted to in our environment and in our diets and things like that, it's coded into these little receptors here by our genes and our DNA. Your genes and DNA determine the shape of the lock, and the lock determines what allergen will go in and turn the lock. So what happens here, you have a food protein with a very distinct shape. If you have a white blood cell receptor that's designed to bind to that, the food will go into there, it turns the key, and the inflammation response comes out the other end. It's far more complicated than we're going to get into in this video, but that's the general mechanism. The key point is these receptors are programmed by your genes and DNA. They have nothing to do with what the internet says is good and healthy for you, what your favorite online guru says, what Facebook, TikTok, or YouTube says. Generic healthy isn't always healthy for us. You have an ideal anti-inflammatory diet, but it's unique to you and you alone. Quite often when people come in to see a naturopath, they've already tried the anti-inflammatory diet protocols, and yet they're still coming to the office. So something you're eating with good intentions isn't healthy for them. We have a separate video on this. Again, this is a really important one. I have all my new patients watch this before they come see me. It's called The Trouble with All Anti-Inflammatory Diets. It explains these technical aspects in terms of the white blood cell receptors, the protein structures, and it shows examples of tests that can explain why healthy isn't always healthy for us, where healthy foods can actually trigger problems for other people. It actually has an example of my test, which you're going to see a little bit later on how rice showed up in my test, and rice actually triggers my skin problem. So I'd encourage you all to go and watch that video. So we referenced histamine quite a bit here. It's that fast type of allergy, the immediate hypersensitivity reaction. Histamine is the allergy molecule. It also helps regulate stomach acid. It's our wake and alert neurotransmitter in our sleep. It serves good functions in our body. It's not always bad. If we cut our arm and we get dirt in there, histamine is a critical part to stop that infection or that dirt from going systemic. The histamine isn't always bad. It just becomes a problem when it's produced in the wrong way and to the wrong things. When histamine is released in the body, there's an enzyme called diamine oxidase, or DAO. Histamine gets produced, this DAO breaks it down. So histamine is constantly being added to the body and broken down in the body. And as long as that balance is there and as long as the level stays fairly low, we don't have issues. It's when there's little imbalances with the breakdown quite often, or the level starts to rise too often, that's where we have these issues. So histamine intolerance isn't really an allergy, it's just when the histamine level gets too high. So where does histamine come from? People typically say, oh, I did a low histamine diet. Well, in a way that doesn't really exist. Histamine is found in some foods. Aged cheeses and fermented alcohols. Histamine is a byproduct of the fermentation process. So some foods do have histamine in them, but not near as many as what the internet says. Histamine can be released in the body by cells called mast cells. When you have an allergen go and burst open these little balloons filled with histamine, histamine gets released in the tissue. Histamine is also produced, but also released by responses to various gut flora issues as well. So when you look at this list here, there's one thing that should be apparent. All of these things right here can be impacted by your diet. You either may be eating histamine, you might be eating something that's causing histamine to be released, or you might be eating something that's throwing off your gut flora balance that then could lead to more histamine. So there's many ways where histamine can become an issue in somebody. Now the slow pathway, the delayed reactions, these are the important ones that I talk to most people about. So to describe this, we're going to talk about vaccines just for a minute. When you get a vaccine, you get a tiny little dose of vaccine about the size of the tip of a pen. That goes into your bloodstream. Your white blood cells, various immune system cells, dendritic cells, B cells, they set up basically a little photocopy shop, and they start producing antibodies and cytokines. And again, these cytokines are what we've talked about a fair bit earlier in the presentation. These antibodies and cytokines go out in your body and they look for anything that looks like the original antigen or allergen or vaccine to attack. Now, some things with the vaccines, when you get this tiny little dose of vaccine, you produce a millionfold antibody response to it. And for a tetanus shot, those antibodies can be good for 7 to 10 years, a flu shot a year. So a tiny little dose of massive immune response lasts for a long, long time. Another critical thing is those vaccine antibodies can take 2 to 4 weeks to get produced. If you go on a trip somewhere and you have to have a shot before you go, you have to have the shot 2 to 4 weeks before you travel. The photocopy shop takes time to produce the immunity. Why that's so important is you can have that exact same response to a food, and this is where all the problems start. So let's describe an IgE or a histamine reaction. You eat a food right here, the antibodies rise really quickly, but they get out of your system very quickly. These antibodies get in and out of the system quickly. They have a very short half-life. Typically, an IgE histamine response is going to be cleared within 12 to 24 hours. So because the reaction, we eat the food right here, the reaction happens right there, quite often we can figure those two types of things out. Those are the histamine types of responses. Now we're going to talk about a delayed reaction. Let's say you eat a food right here. Your white blood cells interact with it. They set up the photocopy shop and they start producing the antibodies. Well, those antibodies can take up to 2 to 4 weeks to reach their peak like this. And then when they stop being produced, they start to break down, but they break down slowly over a long period of time, just like the vaccine antibodies do. So the problem here is you can eat a food right here. You may not have a symptom for 2 or 3 days later, 4 or 5 days later, or a week or two later. Now, if you eat a food here and you have a symptom 3 days later or 5 days later, are you going to correlate those two things? Probably not. So what's going to happen is you'll probably eat the food again, and those antibodies will start to compound on top of the day before. So what happens every time you eat that, the antibodies compound and build up on top of each other. This can lead to a chronic overlapping compounding inflammation that you'll never correlate back to the food in your diet. Whereas with the histamine ones, the reaction is very obvious right here. So you can see where this can cloud and confuse an inflammatory problem in your diet very easily. Now, people say to me, if I had a histamine issue, I'd know about it. Well, there's a reason why they can remain hidden. Let's imagine you eat a histamine reactive food right here, and you have a symptom right there. You could eat a food back here that could cause the exact same symptom right here. The delayed reactions can actually mask and cover up the histamine reactions. So let's say you don't feel well after supper tonight. Right now, you and I don't know if it's what you ate at supper tonight, what you ate yesterday, 3 days ago, or last week. So the way we identify these histamine reactions is actually to get rid of the delayed ones, and then you know the cause and effect is right there. But it's these delayed reactions that produce the antibodies and the cytokines that we referenced so much in the earlier part of the video. So to summarize that slow pathway, you eat a food on a Monday, right here, and you feel bad Wednesday, Thursday, or Friday, you're not going to correlate those two things. The other key point here is these reactions are individual. It's not always the generic bad food. It can be a healthy food. That's determined on a case-by-case basis with your genes and your DNA. It's just as likely to be a healthy food as it could be an unhealthy food. This is why when people are eating healthy and they're still inflamed, this can explain why. So some of the reasons why these delayed issues are so hard to figure out and find in people, well, the standard allergy tests don't test for this. They test for IgE, histamine, mast cell reactivity. Those are the histamine types of reactions. Those tests do not test for IgG or IgA delayed antibodies, and they don't test for cytokine responses. So you could have a negative scratch test to a food and still have a delayed response to it. So you might be eating this food over and over again after being told you're not allergic or reactive to it. People say, well, I ate that food and I was fine. Well, again, with this delayed response, if you ate the food today and you felt bad 3 days from today, you're not going to correlate those two things. This also explains why the food journaling isn't very effective. If you have a symptom today and then you go back and look at your food journal for the last 2 weeks, how do you know what food it was in that 2-week span that caused it? It could have been any food in the last 3 to 7 days, or 8 to 10 days even. So people say, well, I'll just go do a food journal and figure those delayed reactions out. This can explain why that isn't very effective. The other thing is people tend to cut these foods out, but because they like the foods, they don't cut them out very long. Well, yes, I love cheese, but I'll give it up for 3 days and I'll see how I feel. Well, if you eat cheese today, the antibody rises for a week to 2 weeks, and then it falls very slowly. So a short-term elimination, like a few days or a week or even 2 weeks, isn't enough to tell you whether that food is an issue for you or not. So I mentioned before, I'm going to show you my test result. This is just one page of a multi-page test that I had done. The key point I want to make here, though, is that rice and gluten were two of my major issues, but rice is what actually triggers my cross-reaction in my skin and causes psoriasis. I can eat little bits of gluten and it doesn't bother me that much. And rice is considered a fairly benign food. If your pet gets sick, for example, what are you told to do? Feed them rice because it's very benign and healthy for you. Well, for me, it causes problems. The other thing, and I'm not making this up, is ginger and turmeric. If I eat turmeric, which is curcumin, which is supposed to be good for everybody for inflammation, for digestion, it actually upsets my stomach and it makes my skin worse. Now, I'm not saying that's the case for everyone with turmeric. A lot of people get benefit from it. But the generic recommendations don't fit for everybody, and that's what we have to take into account. So the generic anti-inflammatory diets aren't built from your genetic coding and your white blood cell receptors. They're built from population averages. So generic healthy may not be healthy for you. The elimination diets often focus on the wrong components. Everyone blames everything on gluten. Well, I showed you my test, gluten showed up, but gluten doesn't trigger my skin reactions. So because gluten and rice showed up in my test, and rice bothers me, a lot of people think, well, if you would give up gluten, you'd feel better. Well, I actually feel worse. Because what is every gluten-free food made with? What's the flour they use? They use rice flour. So again, these generic diet ideals don't fit with all of us. So we have to identify the correct components for the elimination diet, and that's not just based off generic diet ideals. The elimination diets aren't done long enough. We just talked about that. They aren't done strictly enough. People say, well, I'll cut that food back. I don't eat that much cheese and butter and yogurt, but I'll still have a little bit of cream in my coffee once a day. Well, you would never tell someone with an anaphylactic peanut allergy, don't eat a lot of peanuts, but 1 or 2 is going to be okay for you. And you won't say to a celiac patient, don't eat a whole loaf of bread, but 1 slice is going to be okay for you. So with allergies, everything in moderation doesn't quite work. So we have to be strict on these elimination protocols. And finally, if the elimination diet works, if we start to see benefits, if we start to feel better, you don't go and put all the foods back in, just willy-nilly, because then you're going to be right back at square one again. If you took 10 foods out and you felt better, it didn't mean you were reactive to all 10. It might have been 1 or 2 or 3 of them. So those reintroductions have to be done in a very systematic way to take into account that delayed antibody response, so you can identify which of those 10 foods were actual problems for you. So the goal here isn't to have people eat super restricted diets to feel better. The goal is to diagnose which specific foods are causing the problem so you can eat a much less restricted diet and still feel well. So the point of an elimination diet is to precisely identify the food, not just to blindly take away foods and keep them out. So we need this structured approach. We have to identify all the unique and individual inflammatory markers that are specific to you and your health issues. And again, those aren't based off generic diet ideals. Then we have to remove the foods until you feel better. We have to clear the slate of all the issues, or as many of them as we can, so that when we go to do the challenges, we're going to be able to see the response. Then we challenge the foods. We have to identify the true culprit that we just talked about. Again, the goal is to restrict the fewest number of foods so that you can feel your best. Once we do all that, and if you're feeling better but you're not 100%, that's where we start to do repair work, damage control. We start to put paint and spackle on the walls of the intestine, leaky gut repair, hormone support, hormone balancing, neurotransmitter support. This is where most people jump into treatment because it's a lot easier than changing your diet. But if you do those things and if they work, ultimately they're not going to work as long or as well because we didn't address the primary problem upstream from that. So imagine we have a hole in the wall. We can go and put paint and spackle on that wall, but if we don't get rid of what caused the hole in the first place, we're just going to have to keep doing it over and over again. Repair work works a whole lot better when we stop damaging the tissue. So those 5 types of sleep patterns we talked about before, you can do a little tick box exercise here. If you only have one or if none of them in there, there's a good chance maybe inflammatory issues aren't part of your equation. But if you had more than one, like 2 or 3, or if you had 4 or 5, I can pretty much assure you that inflammation might be a bit of an issue for you. It's very seldom that I see someone with a sleep issue that can't associate with some of the issues that we talked about in this video. So what's the next step? The first step would be to go to that free guide I talked about earlier. It's the first work I do with all my patients in clinic. It's a critical first step in order to figure these food issues out, regardless of what pathway we do to do that. And I'm pretty sure the information in there is information that you've never heard before. So please go and download that free guide. That free guide is also a summary of the first module of the course that I have online. I'll talk about that shortly. All the information that we've talked about in this video presentation, there's research to back a lot of this up. That's found in a book. The link will be in the description called Sleep and Inflammation Revealed. So if you want to research some of the claims on the physiology and the biochemistry and the correlations that we talk about in the video, that's a really good resource for you. Now, the best way to sort through all of these food issues by far is with a clinician or a physician or a health practitioner who's familiar with these types of food concepts and inflammatory concepts. A functional medicine practitioner, for example. There's a lot of complex processes and identification methods and ways to construct the elimination diets and things like that. It's best to do it with someone in person. But sometimes practitioners with expertise in all these concepts I've talked about can be a little bit hard to find. So I have a course online called How to Figure Out Your Ideal Anti-Inflammatory Diet. It talks you through all the backstory information, the background information. It talks about elimination diet protocols, algorithms, reintroduction algorithms. It's a 10-module online video course. That's an option for people who don't have resources or have the ability to go and work with a practitioner. There'll be a link in the description below for that. So none of us want to have inflammatory food issues. We like to eat what we like to eat, especially as we get older. But that doesn't mean those foods aren't causing problems for us. We're better off to know those responses than to hide from them. The other nice thing with this approach is that this isn't just for sleep. It can address a lot of those other issues that we talked about with those compounding loops earlier in the video. So there can be some great rewards for figuring out what your rice might actually be. Thanks, and we're going to see you in the next video.